You're still listening to your favorite dial right here on radio, and it is Radio Global. Well, to all the mothers out there who have wonderful babies who they cherish, yes, you are welcome to the Happy Baby Show. Well, today on the Happy Baby Show, we'll be talking about a topic that tends to touch a whole lot of women when you talk about it. It is about teething. They tell you that, oh, my baby is stooling, my baby has lost so much weight, I don't know what is happening, especially for first timers. So it could be that your child is bringing out teeth, and that in particular could affect the body system of that baby. So that's what we're going to be talking about today on the Happy Baby Show. Don't go nowhere, we'll be right back.
You make me cry.
Why is this child always crying? He cried all through the night and he's still crying again. What's wrong with him?
I don't know. I've changed his diapers 4 times already this morning. He's uncomfortable and I don't know what it is. I'm really disturbed.
Got baby issues? You want to know the best way to take care of your baby? Listen to the Happy Baby Show on Radio Global for new and old parents and from parents to be.
Join me, Amy, on Radio Global at 12:30 p.m. every Thursday, and we will be talking babies.
From the morning dew, the laughter, a joy to remember. Heaven has blessed me with you. The very day you gave to me, my whole life became brand new. Because of you. Oh baby, I see me in your eyes. Oh baby, I see love in your smile. You tell me, Gucci.
A beautiful song, and anytime I hear that song, it just reminds me of all the beautiful babies that are being born each day. Well, if you're just listening to us, happy mother, happy father, it is the Happy Baby Show right here on Radio Global. My name is Yvonne Richards, and today we'll be looking at teething. So if you're a new mother, you're a new father, teething. Your baby is teething when he or she brings out his or her first set of teeth. So if you're a new parent, maybe you're a mother who is pregnant and you don't know about some of these things, I'm going to give you in-depth information concerning all of these. So if your baby is bringing out his or her first teeth for the first time, it is called primary teething. And also you have breakthrough. It's sort of a breakthrough the gums. When you see the little tiny teeth coming out and you're like, why is this baby always putting his or her hand in the mouth, rubbing the gums and all of that? Yeah, it could be that something is growing. There's a breakthrough in the gums, giving way for the teeth to come out. So when does teething typically start? You might ask me that question. Teething usually begins around 6 months of age. So if your baby is up to 5, just know that that's 5 months. Know that baby is getting ready. So when the baby is exactly 6 months, you see that baby will start having teeth. So it is normal for teething to start at any time between 3 months. and even 12 months of age. But at least at the time of 6 months, you are really sure that that baby is going to produce teeth. So some certain babies tend to start at 3. They start to see the signs that they're about to start teething. But when it's 4, 5, and 6 exactly, you should have that baby bringing out teeth from his or her mouth. So by the time your child is about 3 years old, he or she should have at least 20 primary teeth. So if you're a mother who sometimes is inquisitive, you can count. I know it could be difficult even for us as adults to be able to count our teeth. It's not really easy. So now say you want to count the teeth of a baby, babies will not allow you to do that. They will bite your finger before you can do that. So, well, it's all fun. You're the mother of that child. So your baby should at least have, or your child should at least have 20 primary teeth at the age of 3 years old. So as a mother or a father, try as much as possible to make sure that that child is having this teeth. It is very, 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 very important. So the lower front teeth usually comes in first. So you don't have the baby having teeth on top. You have the teeth coming down. They start to come out from the lower front part. As I hear you say, open your mouth, say cheese. When you open the mouth, I know you see the small, tiny teeth in front. So the upper front teeth usually comes in 1 to 2 months after. Then you start seeing the front teeth coming. I know there was a particular time I was very inquisitive and just wondering, why is it always like that? Why? So those primary teeth tend to come out first. The ones at the bottom, the front lower part of the mouth, when you find out the gums, you see that the baby will start producing teeth at that particular area of the child's mouth. So what are some of these symptoms that will tell you that this particular baby is bringing out teeth? So some babies could be very fuzzy when bringing out teeth. Some you find out that it could be very strong. Yeah, some babies are like that. But if your baby is so fragile and the baby is not able to really hold on during this point in time, it could really affect that child a whole lot. So some certain babies might find or see soreness, swelling of gums even before the tooth comes out. For an adult, you have swelling of the gum, but even for a baby who is just coming out, maybe the baby is just 2, the baby is just 3 months, 4, 5, 6, the baby is not even as big as anything and is not weighing much. Now to not have an issue with the tooth, to tell you, it will be very, very, very serious. So some of them tend to have soreness, swelling of their gums and all of that when the tooth is coming out. So some of these symptoms may begin from 3 to 5 days until the teeth shows. So to tell you how excruciating the pain is going to be for that baby, for 3 to 5 days, the teeth trying to come out from where it is in the gum, you can imagine how hard it will be for that baby. So you as a mother, you must be patient. If you've never been patient in your life, I believe that this is the time whereby you should be patient with this particular child. So, and you find out that it will just disappear as soon as the tooth breaks the skin. So many babies don't seem to be affected by teething. Yes, a lot of them. But I do know someone whose child was very affected by teething, that it affected the child's weight. This baby was so big. When he was born, he was so big. And then the mother kept feeding this baby. He became big. But when teething set in, it wasn't up to 2 weeks, I saw that child was already the child had lost so much weight, and you'll be wondering why. And the mother said it's because of teething. That's a big one. So babies may bite on their fingers or their toys to help relieve the pressure in their gums. So they may also refuse to eat and drink because their mouths hurt. It's just like adults do the same thing. You might find it hard to eat, but for a little baby, the baby will refuse to take any food you give him or her because it will affect the gum. They won't drink water, they won't want to eat meals, and you even find that even though like to have something in their mouths. That's why you find that even little toys that are being given to babies, they put it in their mouths a lot of times. So mommies, daddies, please make sure that these toys are washed properly, because this baby will always put it in the mouth and chew and chew and munch just because of teething issues. That's something. So hygiene is another aspect of this. At this particular time, you must take extra pain to make sure that that child is in a hygienic environment, because of what he or she will pick up from the ground and all of that, just to play with and also put in his or her mouth. Yes, you're still listening to us right here on the Happy Baby Show. We'll take a break and pay some bills. When we come back, we'll keep talking.
Why is this child always crying? He cried all through the night and he's still crying again. What's wrong with him?
I don't know. I've changed his diapers 4 times already this morning. He's uncomfortable and I don't know what it is. I'm really disturbed.
Got baby issues? You want to know the best way to take care of your baby? Listen to the Happy Baby Show on Radio Global for new and old parents and from parents to be.
Join me Amy on Radio Global at 12:30 p.m. every Thursday, and we will be talking babies.
It's Radio Global, redefining your radio experience.
When I wake up in the morning, I see your lovely face. Your cheeks like butter, honey from a teacup. You take my breath away. Your pretty little fingers so tender, like petals from the morning dew.
Yes, the music of Jodie saying Coochie Coochie. Yeah, that is for her baby and for all the babies out there who are being born today, and all the babies who have been born even a couple of weeks, a couple of months, and also a couple of years before now. So we're still talking about some of the symptoms that babies could tend to have during the period of teething. So many babies drool during teething, which can cause a rash on the chin, face, or the chest. So you see some certain babies will not tell you, because I know they can't tell you at this time. They'll have rashes on their necks. These babies will tend to have rashes on their chin, on their face. And you're like, in AC, what does it to be have rash all over the face and the chest, and maybe your mother-in-law is telling you that why all this one on these babies? A mother-in-law who will tend to understand, you will know that this baby at this time is having this, and you yourself, you need to explain to her properly that okay, the baby right now is teething. So that one also is very, very, very important. So mild symptoms, there's some mild symptoms which you will not need to worry about and everything. But if it gets severe and worse, please, as a mother or father, do call your doctor in order for the doctor to check that baby and see what is really wrong. So some of the tips that will help your baby during teething are: 1, use a clean finger or cold teething ring to gently rub the baby's gum for about 2 minutes at a time. So many babies find this soothing, although they may protest at first. So you can do it as a mother. You wash your hands properly, wash your finger properly, and put your hand into that baby's mouth and rub that particular area for like 2 minutes at a time. Or you can just get a teething ring. I know a whole lot of mothers know what I'm talking about. A teething ring that the baby can chew, even though he or she doesn't have teeth now, but the baby can just chew to ease the gums. It's also important. Then provide safe objects for your baby to chew on, such as teething rings. Teething rings, babies tend to use teething rings in order to ease the pain of the teething. So you see some teething rings even having water inside of it, moving up and down, and when you shake the teething ring, it moves. Babies like things like that. It tends to make them very, very happy and lively. So if need be, give your baby an over-the-counter pain reliever that is labeled for his or her specific age. Yes, you can give a baby a pain reliever at that time, but that which is for babies. I believe that right now, especially even in Nigeria, where you're listening to us from, there's this particular company now, I'm not going to mention names, but they have a particular pain reliever for babies now, which a whole lot of mothers are going out there to buy. So you can buy as well, and you can use it for your baby too. It will help to relieve the pain that child has at that time. So do not give aspirins to any child which is younger than 20. Aspirins are not for them at all. So even children who are not even 20, you are not supposed to give them aspirins at all, because it could tend to affect their minds, affect their brains, affect their bodies as well too. So it could cause something called Raynaud's syndrome, which is a very, very serious disease. Don't give them aspirins. All these aspirins you see there that people just pack and drink. No, any child who is not up to 20 years, do not give that child an aspirin to drink. Yeah, I know it's shocking, but it is important. So teething remedies, for some certain parents, they will tell you that okay, I want to use a teething gel for my baby, I want to use this and that, but it depends on you as a parent. Make sure that you know what you are using for your child, and make sure that what you're using is the right thing. Don't tend to use what you don't know. That's what puts a whole lot of us in trouble. We tend to use what we don't know for our babies, and it's just something else. So we're still talking about things that you can do to make your baby more comfortable. I've told you before, I've explained some of the things that you need to know in order to help your baby feel very, very comfortable at this time. So try to get treatment for your child if it's becoming severe. If the teething issue is becoming severe and all the time you have to be the baby has to be stooling, the baby has to be feeding or funny crying, or I know they can cry, and even the cry might even tend to be times 10 now because the baby is feeling uncomfortable. At night they'll have temperature, they'll wake up, not be able to sleep, and you as a parent, you will not be able to sleep too. So fathers, please be very, very, very supportive of your wife. Be very, very helpful to your wife at this time, because I know you want to sleep, you want to go to work the next day, your wife wants to go to work the next day, but just be supportive of her, be helpful to her, encourage her, because at this time she needs all the encouragement that she can get, because helping this baby to grow is not an easy thing. There's, on a lighter mood, there's a particular comedian that says that in life there are two things involved. So to have that baby, there were two things involved, the man and the woman. So it's both of you, it's now for both of you to be able to help one another at this time. Don't just leave it for the woman, don't just leave it for the lady alone. It is not done, it is not good. Try to share this responsibility at this time together, and it also makes marriages and makes families bond the way it should. I'm going to just go on a short break, and when I come back, I'm going to be giving you all that I've talked about today, just giving you short summaries on everything I've talked about today in the course of the show. So don't go anywhere, we'll be right back.
Oh baby, my baby. Oh baby, baby.
We handle social events like weddings, birthdays, anniversaries, and also corporate events like
Products launch, networking events, annual general meetings, and governmental events.
It doesn't end there. We also do
Budget management, gifts management,
vendor management, attendance management,
turnkey management, destination management, concept and theme development. Do you know who we are?
We are Madiba Events Limited.
Do you want to organize a stress-free event and you require an accurate delivery?
Then, what are you waiting for? Contact us today at our corporate office,
28B Ajanaku Street, Awuse Estate, Salvation Bus Stop, Okpebi, Ikeja, Lagos. Telephone
0909 375 1330 or
0802 757 2166. Follow us on our online platforms, facebook.com/Madiba Events, our Twitter handle @Madiba Events,
or you can visit our website on www.madibaevents.com.
At Madiba Events,
we give you the honor you deserve.
Oh baby, oh baby.
It's Radio Global, redefining your radio experience.
When I wake up in the morning, I see your lovely face. Your cheeks like butter, honey from a teacup.
You're still listening to your favorite dial right here on radio. It is Radio Global. And on the Happy Baby Show, we've been talking about teething. Teething is one of the things that could make your baby act a lot funny. It can make your baby become very fuzzy. And this teething in itself starts at 6 months. But to some certain babies, they could start at 3 months. So as a mother, you must be watchful and try to observe your baby in order to know what that child is doing at this particular time. So you find out that a whole lot of them might have rashes. They might have rashes in their chin, face, and also their chest. So how do you help them? I told you that you use your clean finger in order to rub that child's gum for 2 minutes at a time. Give your baby teething rings to chew. Also, if need be, you can give the child a pain reliever that is for his or her age, and that way you find out that the baby will be able to be relieved of the pain, and the baby will be stable even at that particular time. So don't give any child who is not 20 years an aspirin. please, 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 this is an order from a medical specialist that children who are not up to the age of 20 should not be given aspirins because it could cause a disease called rare syndrome. Children could get this if they're being given aspirins when they are not up to 20 years of age. Well, this is where I draw the curtains right here on the Happy Baby Show. So I'm saying, as a mother, teething is a good thing. It's good for a child to have teeth. So why don't you have patience and why don't you endure? And you see that baby's tooth or teeth will come out properly. So till I come your way, same time, same place, I'm Yvonne Richard saying, have a beautiful day.
Oh baby, oh baby, oh baby, my baby.
Yes,